Justin.
Hi.
I'm just going to wash my hands. How are you today?
Good.
Hi Justin, my name is Sue Schmeichel. I'm
Hi.
a registered nurse. I'm a clinical nurse leader student. And today we're going to do a cardiac assessment. So could you please tell me your name and your date of birth?
Schmeichel, 11/25/94.
Correct. Thank you. I'm also going to clean my stethoscope right away because we're going to be using that throughout this. Today I'm going to be listening to your heart sounds and looking at your peripheral vascular system, okay?
Mm-hmm.
Are you having any problems today?
No.
Okay. First I'm going to look at your carotid arteries, which are in your neck. I'm going to find this sternocleidoid muscle by your trachea. And there's your carotid. You press one at a time and not for too long. Same on this side. And that is good. I'm going to listen for bruits because sometimes we can hear bruits up in this area. I wouldn't expect to hear that in you. I will be using my bell. What I need you to do is look at the wall and then have you take a deep breath. Exhale. Hold your breath. I'm going to look at the angle of your jaw, mid-cervical, and above your clavicle. Good. If you turn that way, do the same set. Deep breath, exhale, hold your breath. Good. Okay, next I'm going to just check your temperature of your skin. It is warm. I'm using the back of my hands. Your even hair distribution, so you have good arterial flow. Your color is tan. You must be out in the sun. Do you use suntan in lotion?
No.
You should, because you don't want to get sunburned. Your hands are dry. Your nails are pink. Capillary refill is within 3 seconds. There's no clubbing, no lines. Can you put your fingers together like this? And there is a window there, so that is good. And I would have you do that to all the fingers and we can see it, and that is the sign for clubbing. I'm going to check your radial pulses. Pulses are from +1 to +5, and you're +2. It's strong and equal. Then your brachial. Thank you. Those two are also a +2. And then we're going to move down to your legs. Feel the back with my back of my hand. Your legs are warm. You have even hair. Your feet are pink. Your toenails have the +3. And then I look for your pulses. The dorsopedalis is on top, in between the big toe and the first toe. And that is a +2. And then the posterior tibia is behind here. And those are good also at a +2. Check for edema on the tibia and press in, hold for 5 seconds. +1 to +4 is what we would gauge it, and you have none. And again on this leg, none. You can feel your popliteal. Just relax your legs down, which is good. And then your femoral, if you would lay back please, is right here. As long as I have you laying down, I am going to have you check your jugular vein distension. I wouldn't expect to see any on you. You can check it 2 different ways. One way is taking a centimeter ruler and you find the angle of Louis, and then you take a straight edge, and where your jugular vein distension is up, you would measure, and that's how many centimeters. In the clinical setting, if you don't have a ruler, you can use your 3 fingers because that equals 3 centimeters. And again, I don't see any on you. If I would move the bed up to 45 and measure again, and then again at 90 degrees. Also, another test you can do is a hepatic jugular reflex or the abdominal jugular test. That's by pushing in on your abdomen. You might see a momentarily pulsation in the jugular vein, but it should go away if it's there after 30 seconds. then that's an indication of possible CHF or congestive heart failure. As long as you're on your side, Justin, will you turn onto your left side, being careful not to fall off? I'm going to use the bell on my stethoscope, and I'm going to listen into the mitral place, which is mid-clavicular in the 5th intercostal space, and that's where you would hear a murmur if you do have a murmur. And I do not hear any, so that is good. Okay, Justin, you can roll back and sit up. And then I'm just going to check your landmarks up here and listen to your heart. Do you want me to go through your count or should I? So the 2nd intercostal space is your aortic. Move over is your pulmonic. The 3rd space is Erb's point. Skip number 4, go to 5, and that's your tricuspid. And again, mid-clavicular down is your mitral valve, and then you can use one finger to feel the point of maximum impulse, which I can feel. Now I'm going to listen to your heart. Some areas I might listen a little longer. I just want to make sure your heart is beating regular. Normal heartbeat is 60 to 100, okay? And at the mitral place, you would listen for a full minute to get your pulse. And your heart rate is slow. Okay, that completes our assessment. Do you have any questions for me?
No.
Okay, thank you for coming in, and I'm just going to wash my hands, and we are done. How long was it?